Folks, we're experiencing a bit of a Facebook Live challenge, so bear with us. What I'd like to try to confirm is that we're live, and I think we are. Yeah, we are. Good. I just need to share this on my page. We're going to get started. Thank you. I want to take a moment to acknowledge Diane and Roxanne from Mid-Hudson Interpreter Service. We contract with them through Taconic Resources for Independence. And of course, Dutchess County has been trying diligently to ensure everyone, regardless of ability, has access to the information necessary to stay safe, to be healthy, and we're grateful for their time. I've been told that I speak very fast, which makes the sign language interpreting a bit more challenging. I'm waiting to see if Diane agrees. Folks, what we'd like to do this afternoon is give you a brief update as to status of both cases in Dutchess County and some steps that we're still going to ask you to take in order to stay healthy and well. If you have a question, just simply comment below the video, and they'll feed me some additional information, and we'll try to answer as many questions as we can for the hour we're together. So first, I know that you may obviously been following along with us, but you certainly have been watching national and local news, and perhaps even following Governor Cuomo's daily addresses, which are very informative and helpful. They speak about flattening the curve, this understanding that if we can socially distance, if we can keep from transmitting the disease, fewer will become ill, fewer hospitalized, and fewer will lose their lives to this illness. That concept is referred to as sort of flattening the curve, this goal of keeping our numbers low so that we can return to normal, or whatever the new normal is, as quickly as possible, but also most importantly, keep people from contracting COVID-19 coronavirus. So the steps that we have been taking as a community are showing signs of success. We're doing well, but we need to do more. So we'll go through just a couple of bulleted points that I want to be able to cover. You recognize, I think, what basic steps are necessary, and I apologize that we keep repeating them, but it's essential. Simple, basic personal hygiene is a way to slow the transmission of any disease, certainly, but this one, because it's so contagious, and because it can become so severe so quickly, in particular to populations that have a degree of risk, we need to continue to take these basic steps. So social distancing, this idea of being physically separated from folks. If you're at a grocery store and you need to go shopping, you want to do that singly, individually. There's no need at this point to go out as a family to the grocery store or to a store, and you want to be able to stay physically distant from others, and that social distancing will slow the transmission. Secondly, it's very simply washing our hands regularly. While this is useful, the hand sanitizer, good old-fashioned soap and water regularly will keep and slow the transmission, and that's critically important as well. But what is most important is that, to the extent possible, stay home. And that, I think, is absolutely necessary. It's the instruction that every level of government is providing. Just stay home. I know that it's frustrating. I know that it creates a great degree of anxiety. And of course, there are those who are financially, we're all financially impacted in some way, and that is going to be long-lasting, that economic impact. But for now, if we stay home, if when we're out we don't socialize in groups, and we can keep that physical distance, and if we take those personal hygiene steps, we can make a difference. So let's go through a couple of Dutchess County stats so that you're aware of where we are in cases and basic information. Number one, since the onset of COVID-19 here in the county, thanks to a partnership with Nuvance Healthcare, Mid-Hudson Regional, part of the Westchester Medical Center, Pulse MD, and others, Dutchess County residents have had access to COVID-19 testing. We've administered 5,303 tests with currently 1,303 confirmed cases of COVID-19, individuals who have contracted COVID-19. So based on the testing of 5,303 people, we have now 1,303 confirmed cases. Now, of that, and since we began this testing regimen, we have seen 92 individuals go from testing positive to recovery, and sadly, 10 individuals have lost their lives to COVID-19. As you probably have heard, this is going to be a difficult week in the state of New York. New York State and New York City particularly is the epicenter of COVID-19 cases in America. We are going to continue to see a growth in both those who test positive, those who need to be hospitalized, and sadly we are going to see a continued growth in those who lose their battle to COVID-19. And that, I think, is important to understand, and it's why it's so critical we continue to engage in the steps necessary to slow the transmission. Now, you should know that 93 individuals in Dutchess County have been hospitalized in our healthcare system, and I want to talk a little bit about what we're doing in hospital care. Daily, our departments, Dutchess County Government, Department of Behavioral and Community Health, and others are monitoring the number of individuals who are admitted to area hospitals, Northern Dutchess, Mid-Hudson Regional, Vassar, Brothers Medical Center here in Dutchess County. We're monitoring the number of individuals who are admitted with COVID-19 and their status, whether or not they're in an ICU bed or in a non-intensive care bed. Thanks to an effort that Governor Cuomo has initiated, the hospital systems are working much more collaboratively. And for those who need immediate hospital care that maybe aren't going to be provided service at one of the hospitals in Dutchess, those residents may be, as patients, transferred to a hospital that's been opened in Kingston. And through that relationship, we're able to sort of manage as best we can the number of beds that are available. Now, Ulster County yesterday announced that they, similar to New York City, are very close to maxing out their current hospital beds. We are currently holding our own, and the hospital system here in Dutchess is the number of individuals in the system diagnosed with COVID-19 is below the number of beds that we have available, and at the moment, that's good news. Now, the bad news is, of course, that at any given moment, depending on transmission or severity of case, that demand could peak very, very quickly. And so we continue to work with our healthcare providers to ensure that there's adequate hospitalization available to individuals, but we also are now prepared to open an alternate care facility. So Dutchess County, several weeks ago, in partnership with Mid-Hudson Regional and New Vance Healthcare, agreed to convert Dutchess Community College into an alternate care facility. Now, it's not a hospital, but you and I refer to it as that. These are for individuals with COVID-19, predominantly, who could recover without direct hospital care, but don't have the ability to recover at home. And so we're able to make available as many as 500 beds at Dutchess Community College, our Department of Behavioral and Community Health, our Medical Reserve Corps volunteers, and in this case, New Vance Health System is all providing the staffing, and of course we could always use more volunteers, but individuals to provide service at Dutchess Community College, and that's, I think, important for you to know. On Friday of this week, assuming there is a need, we would activate that campus to be available and ready on Monday. Now, we've created a system of checks, if you will, sort of safety valves. Depending on caseload on Friday, the hospitals with Dutchess County will make that decision as to whether or not to open on Monday. And then every day thereafter, if we haven't met the demand on Friday, each 24-hour period, we will evaluate whether or not opening that facility is necessary, and we will have it open within 3 days. And that is just a brilliant relationship and a regular review between the healthcare providers and Dutchess County's health department as to those numbers, and then ultimately to make that decision. So you should know about that in the hospitalization. If you haven't already, you should visit dutchessny.gov, dutchessny.gov, and you'll see the coronavirus updates along with our impact dashboard, where you can see regular updates as to current status of cases and a municipal breakdown, so you can see by town or village or city the number of cases in each community. That will continue to rise. Now, for us, we've seen a slower rate of growth, but we're still seeing growth in both positive cases and the numbers of individuals who are needing hospital care. We also are seeing a continued steady growth of those who are recovering. But you can monitor that, some data points at duchessny.gov on our impact dashboard. And I think that's useful information. Now, one question that always comes up, and so I'll answer it now, is why are Dutchess County's dashboard numbers different than the state of New York's numbers? It's an easy answer, but it's a little bit long, but I'll be quick about it. So on any given day, today, Governor Cuomo in the state of New York announces daily numbers. So today's numbers in the state of New York of those who have contracted COVID-19 or deaths or hospitalizations are announced by the governor. Throughout the next 24 hours, Dutchess County's health department, like every other county health department, has to validate those numbers. Some people don't give us their addresses when they test. Some are mischaracterized as an Ulster resident, not a Dutchess resident. And some need follow-up to determine the true status of that particular case. So over the course of the next 24 hours, Dutchess County will go through those data points. We'll actually speak to those who have tested positive. And then at the end of those 24 hours, over the course of those 24 hours, we'll refine those numbers. And then tomorrow, we'll have the correct numbers that reflect today. So our numbers are always 24 hours after the state of New York. They're always more refined than the state's because that's our job. That's what the state expects us to do. So tomorrow, you will be looking at the numbers that Governor Cuomo announced today, validated, verified, and confirmed. And that's always the way that it works, and it works that way even outside of this emergency. So those are things that you should know as relates to the data points. Now, I do want to talk about a couple other things. I think we have maybe this slide is next. Is this one next? What do you have next? Let's go right to the cloth, the face coverings. So you likely all know that the CDC and the state of New York and our own Department of Behavioral and Community Health have made clear that one of the best ways to slow the transmission, if you're not able to stay home, and this doesn't replace social distancing, so we still want that physical distance between people, is to make use of a face covering or a mask. Now, medical grade masks are in high demand and low supply, and the Department of Emergency Response here in Dutchess, we have an integrated response structure. They've been making purchases and delivering goods and products to healthcare providers, to hospitals, to emergency responders, and others. But you and I can do the same thing by simply making use of some sort of cloth face covering. It could be a bandana or a scarf, or perhaps you might get your hands on a sewing machine and make one of these yourselves. This one actually was made by Unshattered, an organization in Dutchess County who's providing work to individuals who need it, and they're creating these, and I'm grateful to have them, and we're using them. So Dutchess County's Department of Behavioral and Community Health is sending out today a directive to employers and employees to make use of some face covering. And so what I'm saying right now is that our department is saying to those employers who have essential staff who are interacting with the public, we are saying, number one, if a member of your staff wishes to make use of a face covering or scarf of some kind, we're directing that be permitted. Additionally, we're saying that in every situation for an individual who may be interacting with the public, working in an essential job, that you make use of a face covering. So employers and employees should make use of a face covering for that purpose. So let me talk a little bit about what businesses are doing. We have a few questions that we'll get to, and I want to answer them as well. So number one, I want to point to some things that businesses are doing, and again, our Department of Behavioral and Community Health is directing that businesses take these kinds of steps. Adams Fairacre Farms and other grocery stores like them have installed plexiglass barriers at registers, and they're distributing gloves and masks and sanitizers to their employees. That's important, and it's critical to keeping us safe and not transmitting the disease. You know, folks working at a grocery store are first-line responders now because they're essential to making sure we have access to food. Some restaurants that remain open for curbside service on the front line of making sure that we have access to food and meals. So folks like Adams and other grocery stores are doing that. Walgreens is limiting the number of customers into the store at any given time, and in fact marking the floor in 6-foot sections to encourage residents and customers to keep that distance. And we're saying to businesses, if you remain open, this is not a time to be casual about it. So whether you're a Stewart shop or a Dollar General or a hotel, if you are remaining open because you're essential, we want you taking these steps to protect your employees. We want employees to know that they have right to make use of these sort of steps, and we want to ensure that customers are safe as well. There's certain restaurants that are limiting the number of customers and employees by simply doing curbside only. Yes, you can still go to the restaurant and pick up food, but curbside or delivery only is critically important, and it's a good option to individuals who need it. So those are some things businesses are doing. As customers to businesses, we're asking that you take advantage of some sort of face covering. In fact, use it. Wear a face covering. Wash your hands. Maintain that social distancing. And in particular, those who may have underlying health conditions or seniors, we want to be sure that you're taking advantage of perhaps delivery options and not going out. We have to hunker down these next couple of weeks in order to slow the rate of transmission and save lives. Now, what I also want to say to residents more broadly is that, listen, we've closed playgrounds in Dutchess. Many communities have, in fact, removed basketball rims to limit sort of that activity. We need you to follow those instructions. But as other large open spaces are open and trails are open, we need you to take advantage of that escape, to be out certainly in nature. But we need you to engage in social distancing. And to maintain that distance. And what that means is maybe you're a family like mine, there's 6 of us in my family, going together as a unit, that's acceptable. But hanging out with another family together on the rail trail just isn't. It just is not the time to slow on those restrictions. So we need you to honor those things. And by doing that, we'll be able to keep certain facilities open. But we are saying to people we need to limit access, we need to limit that socialization. If you can, limit going to the grocery store. I have to admit that I do know people who go every day. We have to ask you not to do that. We want you as families and individuals to have access to the food and the services that you need, but if you can do once or twice throughout the week, or you can do it once every other week, we want you to do those things as well. It is that kind of slowing of sort of our natural effort to be out and around that will slow the transmission. And then lastly, I'll tell you that I'm going to join Governor Cuomo and join the governor's campaign online to tell you why I stay home. The governor has asked us to on social media to hashtag I stay home for, and actually to talk about why it's important to stay home. So I'm going to tell you right up front. My hashtag I stay home for is for the people who work in this county government every day who are out saving lives. I stay home for the emergency responders who don't need to be worried about me and instead will respond to those who care, who need the help. I stay home for healthcare officials and employees at hospitals. I stay home for direct care providers to those with disabilities because I need all of you to be healthy and I need you to be caring for our loved ones. I stay home for my family. I stay home for my dad I stay home for my dad who's on a ventilator at Westchester Medical Center struggling to stay alive. And it's a challenge for all of us. So I need you to do it too. I need you to stay home too. And I need to ask you to do that because it is so critically important over these next few weeks that we save lives. So with that, let's answer a few questions. I apologize. I didn't think that I was going to say that, but I decided to. Jamie asked about whether hospitals need N95s. Yes, they do. So Dutchess County coordinated a whole host of purchases where what we've learned in this epidemic, this pandemic, is that there is a lack of supply and our distribution system across this country is inadequate at best. So thanks to the state, and I will say thanks to President Trump and to Governor Cuomo and to others, there are resources being sent from the national stockpile, national resources here to Dutchess County, to New York State. We're taking advantage of those and distributing them. Our own department is making hundreds of thousands of dollars worth of purchases in order to distribute product to individuals who need it. And I thank you all who are conserving it and making use of it. So we're trying to get it to hospitals. We're trying to get to nursing homes and assisted living facilities. We support those that are in direct care. We're trying to get those resources there, but we still need them. So if you have resources that you want to donate, visit Dutchess Responds at dutchessny.gov, Dutchess Responds at dutchessny.gov. and we'll gladly accept donations of supplies, but we'll also gladly accept, if you have the means, financial assistance as well. Roger asked, do you think schools will reopen in May? I can tell you that I'm not sure that they would. I think at this point it really depends on when we hit that peak. And if Dutchess County is 2 weeks, let's say 7 to 10 days behind New York City, and New York City is likely to see that peak of cases this week, you could assume that we're 2 weeks, 7 to 10 days after that, and then a slow incremental return to some new normal after that. Based on what we know in this state and what Governor Cuomo has appropriately acknowledged, it's going to take weeks and months to return to a less restrictive environment. So I think school districts are smart, and certainly the governor and others have asked to transition to online or technology-driven education. But I would be very surprised to have schools return in early May. Now, is it possible for students to return in May at some point? Perhaps. But again, it really depends on how good we are at slowing the rate of transmission. And even then, I'm doubtful that you would see a statewide return to much of normalcy in the immediate future. So be prepared for that. I know there are families working hard to provide opportunities to their kids, and I can only tell you that we're grateful to the teachers, the libraries, library directors, and others who are providing resources to students at home. We're grateful for that. Mark has asked if our hospitals are taking COVID patients. Well, first of all, our hospitals are taking Dutchess County COVID patients conveniently, and again, because of what the governor has initiated, and we're grateful for this, sort of the surge capacity does exist at a hospital that they've activated in Kingston. If you're concerned about patients coming from other parts of the state here, first, it is the job of every physician to care for everyone, and we are one big community in one sense. But we also, because the Hudson Valley is immediately behind New York City, in when we expect the total number of cases to sort of peak, the state has adequately acknowledged that it's necessary to make sure resources are available for patients here in Dutchess and the Hudson Valley. So at the moment, our cases our hospitals are seeing Dutchess County patients. There are certainly cases from New York City and that are in need of assistance that will likely either will receive some treatment at facilities north of New York City. I think Albany and other locations have seen New York City patients, but as of today, because of the fact that we're just beyond New York City in peak cases, the state is ultimately obviously trying to conserve those resources here so we can prepare for what is an immediate surge. Now, the other thing I will say to you, and I'd like to be clear, I think was some concern regarding the redistribution of resources. Governor Cuomo made perfectly clear to the Hudson Valley and his staff, made perfectly clear to us in phone calls that we've had, that because of our proximity in dates, if you will, Long Island and the lower Hudson Valley to New York City peaking, that the resources that are necessary here in the Hudson Valley are going to be made available. In fact, they made available ventilators and support to hospitals here in Dutchess County because of the expected peak. And I know that Ulster County has been asking for additional resources, and I trust that they're either getting them or have gotten them in order to respond to the immediacy and the need that we have here. We're all making decisions as best we can in real time. And so the goal is to be sure that we're providing the care when it's needed. And I'm confident that Dutchess County's hospitals right now have adequate support. But again, depending on how extreme cases become and how many may turn, we need to be prepared for what could be even more. So Tanya had asked a question regarding non-essential businesses who are still working. Well, stop it. If you're not an essential business that's been identified by the state of New York, not an essential business that's been identified by the Empire State Development Corporation, you should be closed. And honestly, if you're taking advantage of your employees, you should be ashamed. At the end of the day, we are all engaged in a very selfless effort to try to save lives. And if you know of an individual business that may, it's possible businesses receive waivers from the state. There's a process to do that. So if you are a non-essential business or have a component of your business that is essential, you can seek a waiver, get that considered by the state, and then ultimately perhaps approved. If you're not, and employees are being asked to come to work when they've been deemed non-essential, Then there is a site that you can visit. Come to duchessny.gov, and we'll direct you to that right location. And there is an enforcement effort that is underway to ensure that businesses don't take advantage. And I know that everybody wants to stay active and wants to obviously pay their bills. And believe me, I can't even begin to appreciate personally the economic devastation that we're going to have to confront, and we are working to confront it. But we can't have individuals taking advantage. And so you can visit our site. You can contact your local municipality, law enforcement, or municipal offices. And our job is to respond and to inform them that they ought not do that. Now, the governor established a task force. We have 3 members of Dutchess County. We have 3 members of Dutchess County government who have been assigned to that task force: the Assistant County Executive for Economic Development, the Deputy Commissioner on Emergency Response, and the Undersheriff at the Sheriff's Office have been assigned here in Dutchess to help local municipalities and others enforce the rules. But there's also a very clear way, if you feel like you're an essential business, to ask, and the state and we will give you that direction. And if you're not, we need to honor the instructions. Lisa Marie has asked about Marist College, whether they're being used to house nurses and doctors. The short answer is yes. We're grateful to Marist. So let's talk about the relationship first. Number one, for additional hospital care, right? So out of hospital but medical care, Dutchess Community College with Dutchess County is prepared to open, as I said, as soon as Monday of this coming week, with beds for those who are dealing with COVID-19. So patients that we would want to move out of a hospital setting, so they're not taking up the bed, but can recover without a traditional hospital service, but need some help. That's Dutchess Community College. Vassar College has agreed to be sort of the second wave of care if we need it, more beds for patients. Marist College has stepped up, and we're grateful to them to make a new dorm available to healthcare professionals. I want to thank Ron Hicks, Assistant County Executive, and Rebecca Edwards, County Legislator here in Poughkeepsie, Town of Poughkeepsie, who are leading the effort to make sure that those dorms are available to healthcare providers. Hospitals are working with them. And we also want to thank some local businesses that have come forward to support those healthcare providers while they're staying out of their homes and in these dorms. Haley has asked, what is proper protocol for reporting large congregations, calling the police? So the short answer is, again, I want to reinforce this. This is not the time to have large social gatherings. This Easter, the 6 folks in my family will gather at our house and enjoy Easter, but it will be without my parents, and it will be without our extended family. And we need you to do the same. Tonight, Jewish residents will begin celebrating Passover, and many will be doing it over Zoom or Facebook or FaceTiming on their handheld devices. It is all exceptionally critical that we honor this desire, this need to not congregate. We have churches that I know are so upset that they can't celebrate these holidays, synagogues that can't celebrate these holidays, but they're going online to do it, online, not in line and in person. And so if you are aware of large gatherings, first, be a good neighbor. If it's someone you know, just ask them, is it something that they really need to do? You can reach out to us through duchessny.gov or the Dutchess Responds hotline, 845-486-3555. It's not up there, but 845-486-3555. And you should contact your local law enforcement. You can go online to the State of New York's website for enforcement. But if you go there, it's just going to come back to us, and we'll have to go out and enforce it. So you can also contact local law enforcement. Maria asked, how can you get a note for work to go back after testing negative? We need you to ask your doctor. So if your doctor has prescribed a test, which is the only way you can get a test, it was one of the ways you can get a test. You get a prescription from your physician. If you test negative, your physician should provide you a note acknowledging that you have tested negative and can return to work. I think that's also critically important. So among the other things is please continue to ask questions. We've got 20 more minutes or so. I'll be happy to answer them. But I do want to reference a couple of the hotlines that are available to you. So again, Dutchess County maintains our COVID-19 helpline. That is 845-486-3555. A number of options. We have volunteers and staff staffing that every day. and it's available to you, so please take advantage. If you have general questions or some specific ones you want to access, you have a lack of food and what pantries are available, you need food delivered, and you're perhaps a senior or someone who is living with that particular need, go to 845-486-3555. You can visit duchessny.gov, visit Duchess Responds at duchessny.gov, and we can provide you assistance there. These are stressful times. These are unprecedented times. We are all anxious in many ways. If you're experiencing a mental wellness concern, a mental health concern, you can call or text the Dutchess County Helpline, and that's at 845-485-9700, 845-485-9700. Holly has asked if there is a curfew in Dutchess County. As much as I have many parents who want me to tell their children there is a curfew, there's not a set curfew, but again, the instruction is to stay home. There is no need to head out to Target as a family to go shopping. There is no need to go out to socialize with others at this point in time. If you have to go to the grocery store, one of you go to the grocery store, make that purchase, go home. Now, that's not to say that you shouldn't be out in nature and enjoy this time that you have with family, as stressful as it could, as I know the rest of our lives are. Take advantage of these moments to be together. We welcome you to get to a large open space or to take advantage of one of the rail trails, but engage in social distancing, engage in that physical distancing, and keep us from spreading the disease. So no set curfew, but please stay home. That's important. Eric and others are asking about lending a hand, how to do that. Again, duchessny.gov, duchessny.gov. If you visit Duchess Responds, we're raising hundreds of thousands of dollars. We're grateful to those who have donated. Those dollars, thanks to the community foundations of the Hudson Valley and a team of people that we've organized to make sure that folks are getting access to those resources. We're spending those dollars to buy goods and food and products to be distributed. If you'd like to volunteer, you can visit duchessny.gov. Two kinds of volunteers we're always welcome. We're always looking for. One, if you have a medical background of any kind, we want you to volunteer to the Medical Reserve Corps. You can provide some basic assistance, either on the phone or in person, telemedicine even, or we do need staff volunteers at the community college for our alternate care facility. Then you can just simply volunteer for any number of other efforts that are underway to deliver food, to support food pantries, to answer those phone calls. You can do that from home even. And I also want to thank Greg Pulver, the chairman of the Dutchess County Legislature, and Carolyn Morris, who's the clerk of the legislature. They're working with our team at Behavioral and Community Health, Department of Planning, and others to sort of organize volunteers. And if you've signed up to volunteer and have not yet gotten an email from Carolyn Morris, you're going to get one that's going to thank you for that, and then hopefully try to connect you with those volunteer support services. So that's duchessny.gov, Duchess Responds. Amber's asking when will county workers be returning to work? First, many county workers are working to families and individuals who need it, or the public health staff at Department of Behavioral and Community Health, and countless others. There are still folks at Department of Public Works. Every department in county government is functioning to at least the necessary minimum. And we'd ask you to bear with us, but there are a number of county employees who are working. And I would say to you, those who are working from home are critically important, and those who maybe we don't have an essential task at the moment, but you're staying home, you're doing your job too. And just staying home is helpful. I will tell you that as of this moment, with the governor's New York State on pause order extended to the end of April, I would be hard pressed to believe that we are going to return to some incremental normal in early May. I would suspect that you might see some incremental return, again, incremental, small steps back from total, in essence, stay at home to something slightly less. That could begin in the month of May, but I would not plan on any major shift in policy. If you've watched the national government speak, Dr. Fauci and others, about what steps we're likely to see nationally, and you're following Governor Cuomo's announcements daily. We are in constant communication. It would seem that at the very least, perhaps some minor incremental return to normal, some new normal in the month of May, but certainly not early in May. Lori and Rita have asked me to address golf courses. Listen, the County of Onondaga decided, I believe it was Onondaga, to close golf courses. Now, under the state's order, we have to request the State Department of Health to make such an action. Here's the rule by the state of New York. Golf courses can remain open, but individuals should ride individually in golf carts, assuming you might be a spouse or an immediate family in the same household. It's certainly appropriate to share in a golf cart, but social distancing is necessary, and if you cannot practice social distancing at the golf course, we will be forced to take the same action Onondaga has taken. Now, we have to ask the state of New York to do that, but please, let's be realistic. If you're not in the same household, and you're just a few folks who are trying to get together to play golf, it's okay to be on the course. It's okay to play independent of one another. It's okay to play 6, 7, 10 feet from one another. It is not okay to play together as a group. And I apologize for being that person. I feel at times a little bit like the hall monitor, but the truth is we have got to ensure that we slow transmission. There are too many people struggling too hard. So golf courses can remain open, social distancing at all times. And if you're using a golf cart, it really should be individual use or only those in a single household sharing that particular golf cart. And we've had many questions about that. Other questions, please just comment below. We'll do this for a few more minutes. Want to again remind you that Dutchess County is asking residents and employers to take advantage of face coverings. We're saying to employers, we want your employees, if you're coming into contact with the public, to use a face covering, to use a mask, preferably not a medical grade mask unless you're in the medical community. And we are saying to you as employers, your employees have the right to use them, so let them. And also as businesses, in particular larger retail, or retail of any kind, please take advantage of some of the steps that other businesses have taken. Plexiglass barriers, reorganizing perhaps how you enter and exit a building so that people don't have to come passing one another. Limit the number of people coming in at one particular time. Even in your parking lots, park separate and apart from one another. Perhaps only half of the parking lot should be used. So if you go to the grocery store, use every other spot. And if there's a car there and you're forced to park next to somebody, just go home and try to use the grocery store the next day. So we're asking people to do these things as a means of slowing the transmission. We can see the peak, but we are not there yet. Brenda has asked if farmer markets are going to open and are they essential. Number one, access to agricultural products is in fact essential. In fact, I will tell you, getting to a small farmer stand, in particular one that's not grouped together, might be healthier or safer for you than having to go out into a group setting in a grocery store. And I'll tell you that I've made purchases at the local farmer, one of my farm markets, and because it's sort of one person at a time, it's safe and easy, and there's no concern for safety or health. But farmers markets are deemed essential by the state of New York. They can open. However, they should engage in social distancing and very strict limitations. Now, I want to give credit to the Rhinebeck Farmers Market. Rhinebeck Farmers Market has been working with the farmers markets in New York City that actually have put into practice very strict social distancing and strict regulations on how to come in and out of the space in a safe way. They've crafted those guidelines, and Dutchess County has taken them and is now using them as a model to guide others. I will tell you, if it's not something you need to open, perhaps you shouldn't, but if there's a desire to have those farmers markets open, in every case they're generally permitted by the municipality. So we're giving these guidances to the towns, villages, and cities and saying, here, these are the steps that you should take. Now mind you, again, absence of that social distancing would require us to work with municipalities to revoke permits and not to allow them to happen. But as long as you can honor those social distancing requirements and minimize that, then that social interaction and that physical interaction, then it's possible. Nancy has asked if Quiet Cove is open. So all of the county parks are open except Quiet Cove remains closed, only because it's always closed until Memorial Day weekend, I think. So there's an opportunity perhaps, but I will tell you Quiet Cove, because of its nature, is not one of the parks that's easy for us to keep people at distance. So I did personally get down there the other day, took a look around at things. I visited actually most of our county parks as a means just to see what's going on. I will tell you that most people are really good at honoring the social distancing. On rail trails, some of the trailheads are getting a little bit too busy, and we have to be much more careful about that. So please engage in that social distancing. and make sure we're protecting ourselves. Jenny has asked if it's safe to have our buses running. Well, the short answer is that our bus drivers and our buses are on the front lines of response. Now, keeping in mind that there are whole populations of people who don't have access to cars or transportation that have to still get to a doctor or to a test site or to a grocery store. So we've limited the number of total routes, but we're still functioning. And I want to give a shout out to our bus drivers. They're not Dutchess County employees. We contract for them, but they're part of the Dutchess County family. We've provided them. We're trying to provide them N95s or at least some face coverings so that we can ensure that they're as safe as possible. But they're on the front lines, and I want to thank the Teamsters who represent them, and thank our bus drivers for being out there. Doing that job. It's a good opportunity for me also to acknowledge the folks at all of our bargaining units, Civil Service Employees Association, the Dutchess County Corrections Officers Association, DCSEA, the folks at NICET who represent our attorneys who are still working for public defenders and other capacities, CSEA, did I get them all? NICET, CSEA, the corrections officers at our PBA representing the men and women at the Sheriff's Office, all doing remarkable work. They're giving me notes of the questions being asked. I want to thank those who are extending prayers. I appreciate that. I wasn't intending to talk about my family in any particular way, but I do think it's important to remind people that all of us is touched by this disease. And that there are so many who are struggling so very, very hard. If you have a question, please comment. We have about 15 minutes left. Comment below on Facebook. Happy to answer your questions. Again, let's pull up the two phone numbers so we have them. If you have a question or concern, you can always visit dutchessny.gov, but also visit one of our two hotlines. Hotline is 845-486-3555, and the Dutchess County Helpline. For those dealing with mental health concerns or mental wellness concerns, 845-485-9700. Stacy has been waiting more than 10 days for a test, and why so long? Well, the short answer is we don't have a good answer, and so what I will tell you is that there's a large demand on these laboratories to process the tests. Keep in mind, when you go to a testing site, it's really a specimen collection. They're taking this from you and then sending it to a lab. Some of the labs are moving quickly, others are overwhelmed and inundated and not moving as fast as we all would want. So labs, you could receive your test results back in a day or two, or as long as 14 days. And so there's just such a massive demand and so little, such a little supply, and that's what's been the challenge for a number of these organizations, these laboratories, to do the work that they're doing. I apologize. I'm getting text messages as well, so I want to make sure I'm covering. One of the things that's come up, and thank you, Renee, for reminding us. First of all, as so many folks are now coming into contact and making use of these, and again, I'm grateful to Unshattered. I have a couple of these that I'm very proud to wear, but also it's important to wear these. But if you're using disposable PPE, personal protection equipment, traditional medical mask or rubber gloves, latex gloves, it's important to two things. Number one, if you're using latex gloves and you're picking things up at the grocery store and you're touching your face, there is no difference between wearing those gloves or not wearing gloves. The point of the glove is to do what you have to do, what activities you have to conduct, not touch your face, and then remove them and dispose of them, and then immediately wash your hands or use hand sanitizer. The glove is simply to keep you from transmitting the disease onto your hands and then later onto your face. But if you're eating a ham sandwich while using those latex gloves, you're not accomplishing the goal. You could do that without your gloves on, and we would prefer you not. So if you're wearing those gloves or you're wearing a mask of some kind that's disposable, two important things. Number one, dispose of them correctly. We have found far too many people who think just throwing them out the window is acceptable. It is not, and we're just as happy to enforce littering rules as we are everything else. So please respect the environment, respect your community, and respect the fact that these products are in high demand and low supply. So throwing them out on the street is not helpful. It's not smart, and it doesn't, and it causes us obviously to have to clean up after you. And I know I'm not pointing at anybody in particular, but we all have to do our part. Secondly, if you're wearing this kind of personal protection equipment and you're coming into contact with people who are in fact testing positive, or you know of somebody in your family, for instance, who maybe have contracted the disease, it's important to dispose of these appropriately, which technically in a medical setting should be disposed in a medical waste or medical garbage. But in your own home or your own use, make sure you're removing them, you're packaging them up. Maybe it's in a small bag, or maybe it's just putting them directly into your garbage. But throwing them, in the laundry bin or out on the side of the road for others to have to remove or pick up exposes them to the risk of transmitting the disease. So all of those things are important. And again, this is all about being selfless and helpful to one another. This is not about being punitive. We're asking people to simply do the right thing, because during this heightened emergency, we all have a role to play. We all, in some way or another, can act as a hero to somebody else. Alice has asked, where can I get help for seniors? DuchessNY.gov. Duchess responds. Call 845-486-3555, 845-486-3555, where Office for the Aging staff and volunteers are providing meals to seniors. If you have a particular concern, we have individuals who are volunteering to be helpful, and there are resources available to you locally. And of course, Duchess is attempting to communicate those more through Duchess Response. Several people were asking about price gouging. Again, we're aware of businesses who are taking advantage, and we ask you not to. This mask, while I find it to be exceptionally valuable, is not an $80 sale. And if there are businesses that are taking advantage, the Attorney General of the state of New York, Tish James, has made available a form that you can fill out, and I can tell you they're enforcing it. They're enforcing it because we know that folks are being communicated with by the Attorney General. And as I said, the Governor's Enforcement Unit and this task force they've created has Dutchess County representation on it. So if you're aware of a business taking advantage, we want you to visit you can come to DuchessNY.gov and take advantage of the form that's been provided by the Attorney General of the state of New York, and we're grateful for that. We have about 10 more minutes. If you have a question, please comment. I don't know if there's one or two that we didn't, broad topics that maybe have come up that we didn't cover. Trying to cover it all. I do want to acknowledge that some bizarre coincidence, we are living through this horrible pandemic that is affecting so many people during what is also National Public Health Week. This is a time that we generally pause to acknowledge those in healthcare, both those in the traditional hospital and doctor's office and nursing care, traditional healthcare, and public health, and those who work in public health departments like ours. And we're so very, very grateful to all of you, whether you're in that hospital setting, responding to individuals, or perhaps you're a direct care provider, helping those with a disability or a senior who needs help, or you're one of the folks from the epidemiologist to the commissioner to those working at our hotline at our behavioral and community health department. You are providing a critical resource, an invaluable resource, and we're very, very grateful to you as we all recognize this time and the value of the work that you do. You know, a lot of times we joke in government, county government in particular, that we're a little bit like your water pipes. We do the job well enough that you don't often recognize we're there until we're not. And what we have found these last several weeks are there are countless people who provide ordinary, everyday service that under these circumstances are so critically important, and we're grateful to all of you. Other questions that you might have, just comment. I don't know if there's a topic or two that maybe's come up that I want to be sure that we get to. I'm very grateful for you spending time with us. So I do want to mention as we're winding down, but we do have a few more minutes. We have a telephone town hall and Facebook town hall scheduled for 5:30 p.m. next Wednesday, so April 15th at 5:30 p.m. Telephone and Facebook town hall again, and we want you to participate in that. I will offer to you that next Wednesday morning we're hosting a similar Facebook Live event for the business community. I was to give a talk to the Chamber of Commerce next Wednesday, and rather than cancel it, we're using it as an opportunity again through a Facebook Live and telephone town hall to have a conversation with businesses. I will tell the business community then, but I'll say it now. We are fighting as hard as we can to get the federal and state government to pay attention. There are too many people waiting too long for unemployment insurance. The governor has acknowledged how difficult that is. I think today announced an additional $600 commitment to those seeking unemployment insurance. But getting through the system is certainly they're overwhelmed. But we've got to make that system a little bit easier, and we'll work with the state to make sure that happens and try to advocate as best we can. The federal government, grateful to our federal leaders from our members of Congress right up to the president for signing into law this CARES Act and the COVID response. There are resources, but we've got to make sure local banks can access the Small Business Administration loans and make sure their customers can access those loans. We have to be sure that there's an easier access for farmers and agriculture. So we're going to advocate for those things, but we'll talk a little bit more about them over the course of this week. We've got some great businesses working really hard. I was up at Unlimited Tomorrow today. Unlimited Tomorrow is the name of the business. I was there today. They're making face shields. I was out in action in Ulster County with the Ulster County Executive Pat Ryan, where we've purchased some 5,000 face shields that are being distributed. People are asking about fast food and gas station employees not wearing masks. Here's my answer. Wear the masks. The Department of Behavioral and Community Health, this county government, and the state of New York has joined the CDC and the federal government. Wear a face covering. It doesn't substitute for physical distancing, but it will slow the transmission. So I want to make this perfectly clear. We are directing businesses to allow their employees, if they're deemed essential, to make use of a face covering. And we are saying to you, use the face covering. If you've got a scarf or bandana you want to use, that is important, and use it. If you have access to a homemade face covering, use it. We're providing you a way to actually make them if you wish. Use it. And I will tell you that our goal is to say to all of the business community, do it. So if you whether it's fast food or grocery store, if you can put up those plexiglass dividers, do it. If you can put up lines on the floor to keep people 6 feet apart, do that. If you can alter your exit and entrance in your business so you're in one way and out another, do it. And if you can provide your employees some face covering, do that. But employees should be encouraged. We're asking businesses to allow that, to make sure that happens. We've got about 5 minutes left. We want you to do it. So we know that we are close to what we expect is the peak period. We can see it, but we have more to do. A lot of folks asking about ventilators and access to hospital beds. As I said, Dutchess County is prepared this Friday to open Dutchess Community College on Monday as an additional care facility for those who are recovering. On Friday, with Nuvance and the healthcare community, we will decide if Monday is necessary. And if it's not yet necessary, on Saturday we will make that determination, and then every 24-hour period thereafter, we'll be ready to open if necessary. Currently, hospitals have capacity, thanks to Governor Cuomo and the sharing of resources here in this particular region. We have capacity, but that can change very, very quickly. This illness can become very severe very quickly, and that is something that we have to be prepared for. We believe we have adequate access currently to ventilators, but that could change overnight. And so the state did make available some ventilators to one of our area hospitals. The support structure that's in place among these hospitals is adequate today. But if we see a turn in number of cases and the severity of those cases, that can change overnight. We have assurances from the state that they recognize that the Hudson Valley is immediately behind New York City and Long Island, and we're grateful for that. And that's where we're focused at the moment. We have a couple more minutes. I don't know if there's any other topic or topic area that's not been covered. There were questions last week I want to mention about county staff, in particular corrections officers. I want you to know a couple things. One, that we've heightened since the onset of this, we've heightened the cleaning of the county jail facility. There are still inmates there, and certainly our corrections officers are on the front lines in those facilities. We have provided medical personal protection equipment to the COs. There's an adequate enough supply for several weeks based on the demand. They should be using them when they interact with individuals, and any individual in the county jail who may have some symptoms would be quarantined. Now, at the moment, no inmate has tested positive for COVID-19. We do have the medical staff there that's able to provide those tests. We do have, I think, a couple that have tested positive for the traditional flu, and they're isolated. And a number of COs, because of the nature of that particular facility, are home and not reporting to work in order to self-quarantine. So there are those who, a couple COs have tested positive. They didn't come into contact with inmates. There's not a transmission, but they're being quarantined, and then an abundance of care is being taken to ensure others are. So I know those questions came up last week. Again, next Wednesday, April 15th at 5:30 p.m., another live telephone and Facebook town hall. That morning, a business community town hall, and you'll receive more information about that. Every Wednesday, we will be right here at one time or another every Wednesday with a live Facebook town hall to answer your questions. The communication staff actually staffs our social media presence, I want to say from like 8 or 9 in the morning to like 10 o'clock at night. So if you're posting a comment, we try to get to as many reasonable requests as possible and respond to them. If you're sending us a message through social media, we try to respond to them as well. But again, it's every day from early morning till about 10 p.m. at night, 9 p.m. at night, you get responses. Very, very important for us to remain in contact with one another. Any last topics from social media? We've got about a minute left, so I'm going to take this opportunity to reinforce what I said. Number one, you can find this online. We're distributing this to employers. The Department of Behavioral and Community Health, at our request, is directing businesses, if you are essential and you have employees that are essential and that they are coming to contact with the public, your employees have every right and are expected to cover their faces. It's so critically important that we slow this transmission. So if it's a specially made face covering like this, or one that they can make, or simply a scarf or bandana, they are to wear it, and an employer should make every step to make that happen. We want to thank businesses like Walgreens and Adams and other restaurants who have taken steps to limit the number of people in their businesses. Grocery stores, Dollar General. If you have a large parking lot, we're going to encourage people to park in every other spot. We need to limit the number of folks getting together in larger settings so that we can weather this for the next couple of weeks. If you're doing your own grocery shopping as residents, we'd ask you to limit that to only a couple days a week. I know that it does change the way we kind of function, but we're asking for this to happen because if we do it, we're going to save lives. It is 4 p.m. We're going to be here again next week. In the meantime, please do what you're doing. We are definitely making a difference, but it's critical we continue to do more. I thank you all for your thoughts and prayers. We are all trying our best to do our best. So on behalf of Dutchess County and its nearly 300,000 residents, I'm grateful to you. Please stay strong. Please stay safe. Please be kind to one another. And to those of you celebrating Passover, we wish you good health. To those of us who will be celebrating Easter, we wish you a tremendous holiday. And to all Dutchess County residents, regardless of faith, have faith that we will weather this storm together, we will overcome this together, and that we are all in this together. Thank you.